Amino acids are indispensable nutrients with critical relevance in the female population, particularly during the period of heightened physiological demand such as growth, pregnancy, and lactation. They contribute significantly to the maternal metabolic homeostasis, support fetal development, and facilitate physiological adaptations required during lactogenesis. A sufficient supply of amino acids throughout all trimesters is essential for supporting a healthy pregnancy and ensuring optimal fetal development. Pregnancy further complicates the already intricate metabolism of amino acids, as the expansion of blood volume and growth of maternal tissues significantly increases the protein requirements. Additionally, the development of the fetus and placenta places further demands on the mother's protein needs. Dynamic exchanges and regulation of amino acids amongst the mother, placenta, and fetus are observed during pregnancy. Maternal amino acid pools are maintained with the help of maternal diet, metabolism, and gut microbiota. Within the placenta, the amino acids are stored in the placental amino acid pools before being delivered to the fetus. The transfer to the fetus occurs through facilitated transporters. These allow movement along concentration gradients and exchange transporters which continue the bidirectional exchange process. Once inside the fetal circulation, amino acids contribute to the fetal amino acid pools, which are essential for protein synthesis and overall fetal development. This tightly regulated system ensures that the growing fetus receives an adequate and balanced supply of amino acids throughout gestation. Proper regulation of the amino acid pool is critical during pregnancy, as imbalances in maternal amino acid metabolism can negatively affect the fetus. These imbalances may lead to fetal programming, a process through which the intrauterine environment shapes the fetus's development in ways that persist even into adulthood. The disrupted fetal programming increases the risk of developing cardiovascular, kidney, and metabolic syndrome later in life. Amino acids are a vital nutritional component of amniotic fluid, playing a crucial role in fetal development. Maternal caloric intake can significantly influence the concentration of amino acids within the amniotic fluid. In this context, the observed increase in the mean amniotic fluid index following maternal intravenous amino acid infusion suggests a potential underlying intrauterine nutrient deficiency that may be responsive to supplementation. Amino acids play a fundamental role in fetal development by meeting the carbon and nitrogen requirements of the growing fetus. By serving as the building blocks for protein synthesis, they also are a key regulators of placental and fetal development and support metabolic exchange pathways between the placenta and the fetus. Amino acid supplementation, administered either orally or via IV infusion, is commonly used in the management of oligohydramnios. Such supplementation has been seen to enhance vascularity through increased nitric oxide production and stimulate insulin secretion, both of which are critical for optimal fetal growth. Notably, a significantly greater improvement in AFI has been observed in patients receiving IV amino acid therapy compared to those receiving only IV hydration. IV amino acid and hydration therapy have shown to improve estimated fetal weight and perinatal outcomes. IV amino acid infusion is an effective intervention for managing oligohydramnios associated with fetal growth restriction, significantly enhancing the AFI after 7 and 14 days of treatment. This therapy is associated with higher rates of vaginal delivery, increased birth weight, improved ABGAR at 1 and 5 minutes, and reduced neonatal complications compared to those not receiving the infusion. Amniotic fluid infusion serves as a valuable source of amino acids for the mother, helping to enhance her nutritional status and support, giving favorable pregnancy outcomes. Intravenous amino acid infusion, in particular, has been associated with improvements in the amniotic fluid index, likely due to the direct and efficient delivery of nutrients. Such improvements may be difficult to achieve through dietary measures alone, especially in cases where non-compliance or socio-economic challenges limit adequate nutrition. In a study, especially in women aged gestational age 28 to 40 weeks, the group that received amino acid infusions demonstrated better perinatal outcomes compared to the control group, underscoring the clinical benefits of intervention in maternal and fetal care. Amino acid infusion in patients with oligohydramnios has been shown to significantly improve perinatal outcomes. It is associated with a reduced incidence of cesarean section, meconium-stained amniotic fluid, low APGAR scores, and neonatal intensive care unit admissions. People who receive amino acid supplementation demonstrated a higher rate of vaginal deliveries and a lower number of neonatal deaths. Additionally, the frequency of low APGAR scores at birth was markedly reduced in this group. Overall, amino acid infusion contributed to better neonatal health and reduced the need for intensive care interventions. In normal pregnancies, the maternal infusion of the same commercial amino acid solution increases the maternal amino acid concentration, which is associated with the greater uptake of most amino acids by the umbilical cord. In cases of idiopathic oligohydramnios, IV amino acids may be beneficial in reducing maternal morbidity, perinatal morbidity, and mortality, thus improving the pregnancy outcomes, particularly in developing countries. Studies have shown that IV amino acid infusion is associated with an increased rate of vaginal delivery, a reduction in neonatal complications, and fewer admissions to the Special Newborn Care Unit (SNCU). Intravenous amino acid therapy has shown improvements in amniotic fluid index, estimated fetal weight, and overall perinatal outcomes. This treatment proved to be an effective approach for managing oligohydramnios associated with fetal growth restriction, with a significant positive effect on the AFI after 7 and 14 days of supplementation. They stimulate the mTOR signaling pathway, promoting the synthesis of key milk proteins such as caseins and lactalbumins, which enhance both the quantity and the quality of breast milk. Amino acids also aid in the proliferation and differentiation of mammary epithelial cells, support hormonal responses essential for milk secretion, and provide key precursors for neonatal growth and digestive development. Thus, amino acid supplementation, particularly the infusions, the intravenous infusions, plays a critical role in pregnancy and fetal outcomes.